My name is Gary Stork. I'm a glaucoma patient from Wisconsin, and I've also found it very useful for degenerative disc disease and arthritis as I've aged. And with me today, I have some other people from Wisconsin. Jennifer, who's an MS patient, constituent of Mica's, Representative Mica's colleague, Mr. Sensenbrenner. Jacki Rickert from Mondovi, Wisconsin, who has a rare connective tissue disorder, Ehlers Danlos Syndrome, and advanced reflex sympathetic dystrophy. And with her as a care provider, and also Joan Legoski from Washington State, another MS patient. And we find it really hurts people like us that Representative Mica would get up and debate, like on the Hinchey Amendment, and denounce our medicine. I can tell you for a fact that Jenna and Jacki, and I just met Joan, but they would not, Jenna and Jacki would not be alive today and here today were it not for cannabis. Jacki was fully approved for the IND program by the federal government, and George Bush the first closed the program on her, and she never received her medicine. She was approved by the FDA, the DEA, NIDA. They were going to give it to her. They told her they were going to ship it to her. She never got it. The federal government supplies it to 7 living Americans. So we don't like it. It really hurts us to hear Representative Mica say things about patients that we would lie about this. These are good people. We're sick through no fault of our own, through an accident of birth. Why would Representative Mica want to say things like that to hurt good people like this? We didn't ask for this.
I don't think he's actually saying it to hurt people like you. I think
but he's hurting us by saying it. I watched the Hinchey-Rohrabacher debate, you know, and he said some very upsetting things to people like this who owe their lives, their continued existence to this medicine. And you know, we would like him to look into his heart and wonder why he wants to hurt good people like this by saying things like that. Why not just let us have it and move on?
Okay. I mean, if he wants to debate the microerosion, he's walking the debate on whatever way he wants to. But the medical issue is between doctors and patients.
Mind you, 2 patients in the state of Florida go to the pharmacy at the University of Miami and pick up federal supplies of marijuana. It is not such a stretch to believe that we couldn't open programs that would be handled just the same way.
That's only 2 people that are allowed in the whole state?
There's 2 people in
Austin,
7 in the country, and 2 of them happen to be Florida constituents.
I would like to say something.
Okay.
As Jacki's care provider, I have seen some of the wonderful effects that it has. And to my knowledge, I don't think you can overdose on cannabis. There are no harmful side effects to cannabis. The side effects are actually helpful. Some of the numbers of prescribed drugs that are out there have more deadly side effects than cannabis. It's a God-given grown herb. God put it on this planet. It's in the Bible. It should be available to the patients who need it, to live, to survive. They don't just want to exist. They want to have a decent quality of life.
One thing
I'd just like to add
is that everyone here has talked to their doctor. They're here with the understanding of their doctor. These are not people who are self-medicating. They're all doing this under care.
Notes from my doctor.
I'm sorry to interrupt, Jacki, but I want to make sure he was clear that.
I just wanted to add that I refuse to believe I'm the only one that has ever had a reaction to Marinol. So that's not even an option for me. My daughter came in my bedroom after my doctor was completely assured that Marinol was very safe, very effective. Well, when I woke up, when you first wake up and you can't breathe, I mean, that's shocking. You don't really know what's going on at first. And then the realization that my tongue had swollen up so large that my doctor had to actually cram a straw in so I could breathe. So, I mean, that is not an option. And when we're hearing, you know, is there anything other than cannabis? Well, obviously, you know, just like all the different ailments that we all have that none of us asked for, one size does not fit all. Any medication,
Yeah.
completely over the board. It's just that way. If there were something
We're tired
that
of
would work
hearing
and it
that.
was simpler, I don't think any of us would go through all of this to say, you know, we really need cannabis. If it didn't work, it would be so much simpler to say, if something else worked, it would be wonderful. But for some of us, most of us, there isn't.
I'd just like to say, we keep hearing people like Representative Mica say there are other medications available. Well, we've all exhausted those other medications. We found the side effects intolerable. We found the side effects so bad they've taken us away from our families. They've hurt us. They've caused us more problems than the diseases itself. We've exhausted the other remedies and we need cannabis. We know that works. We know it's safe. We know it's not going to kill us. We know it's not going to throw us for a loop.
I'd just like to say something. I've been in remission ever since I've had a prescription, a recommendation for cannabis, and before that it was like the never-ending story, just one attack after another. I got a prescription for cannabis, I tried it, and I haven't had another attack since. I've been in remission for 7 years, and it's like hope when they thought there was none. You know, and my only problem now is not being attacked by the MS, but being attacked by the laws that state that I can't keep it in my state. And I live in Wisconsin, but my prescription is originally from California, and they honor me to allow me to keep my prescription valid in the state as long as I have a prescription. So I have to keep flying back to California to renew my prescription, even though my Wisconsin neurologist completely 100% supports me on having a prescription for cannabis.
And she was paralyzed from the neck down before she started using cannabis. She would be in a nursing home or dead today, not in a wheelchair and able to walk with the assistance of a cane sometimes. And same thing with Jackie. She would not be here today. It's given them lives. It's given their families more time with them.
Never was an issue on being high. My muscle relaxers are so strong that I became a total idiot on them. And also, malleable, like I couldn't do nothing. I became a zombie. So I took myself off of pharmaceuticals and I began to make them high, much to the dismay of my family. My family was not in favor. They did not believe me either. But now, 18 years later, a lot of people believe me.
It's amazing, and I think I can speak for every patient that I have talked to in this whole entire weekend, that we don't want to live our lives on these extremely high doses of medicine to take our pain away, and we don't want to sleep in bed and not be able to get out and enjoy life like the rest of the population does. But and this drug, this marijuana, actually helps us to be able to live our lives on a normal level. But we're not so drugged up that we can't get out of bed. We're laying in bed all the time. We can actually function in society like normal people do. And it's so simple. I mean,
I don't think we're going to take up too much more of your time. We really appreciate you sitting down with these people. It does mean a lot to them. I'm Chris Mulligan. I'm also from Florida. I live here now, and I just wanted to let you know that Cathy Jordan is the only Florida patient here now, but we have 15 patients in the state of Florida who wanted to come here. Most of those being MS patients and a couple others with different ailments. But I mean, there are a lot.
Is this a specific organization that you'll?
Well, there are a lot of organizations involved in this coalition. You know, I work with Normal. There's other groups that have helped out extensively on this project.
It's the Cheryl Miller Memorial Project. We all came here. There is a number of organizations involved, and we all came. Cheryl had been up here for the last several years.
She made 9 trips to Washington in her lifetime. Well, that's her wheelchair Jackie's in, and Cheryl would lay in that. It was fully put back because 32 years of MS had done that to her. And if she had access to medical marijuana early along like Jennifer did, Cheryl might be here with us today too, you know, but we wouldn't need to be here then.
The whole thing is, even traveling here, being a patient, and telling the government that I am breaking the law, I am smoking marijuana to keep myself alive. I consider him a smoke pot and not really care. But there are other people out there with my disease that do not know that cannabis could actually slow their disease down. And I am doing this because if it works with me, and now the research shows it's working for other people, then it should be available to everyone.